In the previous video, I mentioned that there are some issues with records access and some potential risks, as well as some significant benefits of accessing your medical records. Well, to try and help yourself as a patient to try and ensure that you get the maximum benefit and minimise the risk as much as possible, we in Tameside and Glossop PCT have decided to set up something called a Local Care Record Development Board. The idea is to try and get all the significant people within all the different health and social care organisations within this particular PCT, within Tameside and Glossop, to try and discuss what records access is, what it means, and try to ensure that the benefits are maximised and the harms are minimised. At present, this particular board is chaired by a layperson. In other words, not a clinician or a manager, but who is a non-exec director of the board of the PCT. It has on it GPs, nurses, the medical director of the PCT, hospital consultants from the Acute Trust, hospital consultants from the local mental health trust, because there are some significant issues around mental health problems. We've got members from the local social services, and we also have clinical governance managers from the PCT, as well as the out-of-hours service, Go2Doc, as well as from the Acute Trust and the Mental Health Trust. We also have the Caldecott Guardian within the PCT, who is in charge of ensuring that confidentiality of patients is maintained throughout the organisation. We also have a number of patient representatives. Some of these patients also have access to their medical records, and they are there to ensure that patients also have a view. And what do? What do the Local Care Record Development Board do? They identify and promote the values and principles which should govern the development and implementation of the NHS Care Record. They advise the PCT's board and the Professional Executive Committee, which is made up of clinicians, on the development of the NHS Care Record. They ensure that ethical and policy issues, including those concerning security and confidentiality, are adequately addressed. They represent users of the NHS Care Record, including patients, the public and staff in health and social care, and ensure that we reflect their views and interests. They enable users of the NHS Care Record, such as yourselves, to be included and engaged in its development as well as its implementation. They support an inclusive communication strategy that keeps all stakeholder groups engaged in the development of the NHS Care Record. And finally, they identify the risks and issues arising from the development and implementation of the NHS Care Record, and to propose solutions to those risks and issues. In summary, they are there to try and help you get the best out of records access by ensuring that all stakeholders, including the GPs, nurses, social services, the Acute Trust, the Mental Health Trust, and the PCT, as well as patients, are involved in discussing some of the difficult issues and how we can try and support records access and move forwards with it. They're there for you, to help you, to ensure you get the benefits. So why don't you try and contact the Local Care Record Board and find out what's going on, and if you do come across any issues, if there are things that you're not happy about, if you come to any significant harm as well as any benefits, then why don't you inform the Local Care Record Board by contacting the local PCT and finding out and ensuring that they find out what the issues are so that they can discuss them further.